27-year-old Renuka was rushed to the casualty with her right hand being completely paralyzed and she was experiencing excruciating pain. She was a university teacher and a young mother, and as beautiful as her pregnancy and postpartum was, it started a molecular war inside her body which accelerated an already ticking time bomb which was just about to go off. Something inside of her and the signs and symptoms were clear from day one, but she had ignored them all. And the report which Dr. Rahul had just shown her shocked her to the very core. Hello everyone, I'm Anuj Pachhel, an intern at Government Medical College Nagpur, and welcome back to my channel and to this episode of Case Files, a series where I discuss rare cases in depth and tell you how beautiful and how complex the human body actually is. Before you go ahead, if you're a NEET aspirant watching this, the best way to increase your marks in NEET is to solve previous year question papers, and the best source for that is Oswal's previous year question paper book. It comes for all the three subjects: physics, chemistry and biology, and this book contains previous year question papers all the way back from 1998 to the recently solved 2023 May examination of NEET. They are distributed chapter wise, so it's very easy to find them, and appropriate solutions have been provided. There are mind maps which help you revise the thing very fast. The most amazing trend analysis which tells you what is the distribution of questions that you have from different years. The only book that I've ever promoted on my channel is Oswal books because I have a certain trust in them, and I'm 100% sure if you're a dedicated aspirant using these books, they will definitely increase your marks. Click the first link in the description and start solving today. Let's get back to the case. 3 years ago, Renuka was just another 24-year-old student who was pursuing her PhD from a reputed institute. It was a very casual day and she sat down to enjoy a meal, but while having a meal, she felt something in her stomach. She felt a heartburn, which was pretty normal for a student to have at that point. Immediately, she took an Eno powder and it all seemed to resolve. Her examinations came and the stress and anxiety were super high. During that stress and anxiety, she also noticed that almost every other day she is getting this dyspepsia, this acidity which we call, this heartburn which we call in the medical terminology. And for that, antacids and Eno powders became her go-to. She read about it on Google that stress and anxiety cause increased acid reflux and increased heartburn. So she automatically connected these two things. Little did she know that these seemingly harmless things which she was ignoring by eating antacids or Eno powder were early indicators of something much more perilous, silently lurking in the shadows. Time flew by, she never went to a hospital, but this dyspepsia which she was facing did not seem to resolve. Even after the exams was done, even after her PhD was done, this acidity which she was facing continued. She never thought of going to a doctor because why? Because she already had the medication, she took it and she felt symptomatically relieved. Just like that, time flew by. She met the love of her life, tied the knot and awaited the arrival of their bundle of joy. During the pregnancy, she noticed that her hands, specifically her fingers, would ache a lot when she tried to sleep, especially if the hands were exposed to the cold, such as when the AC was on and her hand was left outside the blanket. Just a Google search later and she found out that there are so many different changes happening inside a mother's body during pregnancy, and this could be one of the normal physiological changes. So without worrying about it too much, as the pain was really mild, all she used to do was put her hand inside the blanket when sleeping, and that seemed to completely resolve the issue. The discomfort never bothered her during the day, but it persisted during the night even after she had her baby. Soon after her daughter's birth, Renuka embarked upon a new journey to become a university teacher. She shared her knowledge of mechanical physics with the eager students that wanted to learn from her. The job went well, except there was one problem which she had. See, the classroom that she was taking classes in had a blackboard, and whenever she used to use the chalk to write on the blackboard, her fingers would feel restricted, they would feel a bit swollen, making it difficult to move fluently. After researching online yet another Google search later, she discovered that maybe this was something called as a chalk allergy which many people suffer from. So obviously, she shifted to a class which had a whiteboard. However, the stiffness of her joints still continued, and it was specific to the finger joints only. The stiffness slowly grew over the last year, but it did not catch her full attention because the progression was so slow. And one fateful day, the time bomb which I was talking about finally went off. While she was teaching, the hand outstretched writing on the whiteboard, she felt excruciating pain in the fingers and in her hand. That pain was so intense, she dropped the marker which she was holding and noticed that her hand would not cooperate. Her hand just experienced a sort of weakness. A weakness that would gradually progress, involving the entirety of the wrist joint. And it was so severe that she was barely able to move some fingers. As this happened, we come back to the story of today, where she was rushed to the casualty with this particular symptom of weakness in the right hand. Case file number 2, Renuka. 27-year-old married female university teacher by occupation presented to our casualty with chief complaints of weakness in her right hand since one day. The weakness was sudden in onset. She noticed it while she was teaching a class in writing using the same hand, and it was progressive in nature. Initially, she was able to hold the marker and write, but it was progressive, so that currently she was not able to move her fingers properly and able to grip any object. She is able to move her shoulder joint, and there is no weakness in the proximal muscles of the body. The weakness of the hand is particularly exaggerated by overhead abduction of the arm, and it is also associated with tingling, numbness and pain. The pain is sharp, needle-like and sometimes throbbing. There are no relieving factors for this weakness. There is no history of trauma so as to rule out any pathological fracture she might have sustained in her vertebrae. No history of cough or fever to rule out tuberculosis, which might cause a swelling in the lymph node and cause the compression of the nerves to the hands. No visible swelling over the neck area. There is no history of unintentional weight loss so as to rule out a malignancy, a cancer that might be present in the apex of the lung that might be impinging upon the nerves which are coming out from the brachial plexus. A malignancy which we commonly call pancreatoma. She is not a smoker nor an alcoholic. Her menstrual cycle is normal and her UPT is negative. Upon inquiring for the past history, she said that she had this feeling of tingling and numbness since the last 1 year. However, it was very mild and she did not take much notice of it. She also said during her pregnancy, on exposure to the cold, the fingers would cause a lot of pain. So she used to keep the fingers inside the blanket in order to avoid that situation. On carefully asking whether or not she found that the fingers changed the colors from going absolutely pale to red to blue, she denied, saying that it always happened during the night, so she could not visualize the cyclical color changes that could point us towards the diagnosis of Raynaud's syndrome. She also said that she had been feeling stiffening of the joints of the fingers before it all began, and very surprisingly she also told us that it was happening on both hands. So both of the joints were symmetrically stiffened. There is history of consumption of ranitidine tablet, a common antacid which many people take. Past 3 years, approximately 2 to 3 tablets per week because of the intense amount of acidity or heartburn she is suffering from. There is no history of diabetes mellitus or hypertension. General examination, the patient is conscious, cooperative, well oriented, time, place and person. The vitals are all within normal limit. On head-to-toe examination, the specific findings that we found were: pressing on the right side of the nape of the neck, the weakness is worsened and the pain is back. There is no swelling palpated superficially. There is no similar sign on the left side. The skin of the hands, both the hands, is thickened, stiff and it is dry and shows loss of appendages. The nails are atrophic, they are thinned out, but passive stretching the fingers, it is very difficult to stretch them beyond a certain points because the skin is so much thickened. An active stretch actually causes pain. On carefully examining the back of the patient, see that there are multiple 2 to 7 mm macules which are present on the back, which are bright red in color, likely telangiectasias that appear like small mats. The examination of the breast and genitals is completely normal. Systemic examination is within normal limits. We ordered the chest x-ray because we were suspecting lower motor neuron type of palsy in this patient. Could it be tuberculosis? Could it be a tumor compressing? Could it be a lymph node which was compressing? Could it be something else entirely? The x-ray showed that she had actually formed a small stone, a stone compressing over the nerve which was supplying the hand. This stone appeared out of nowhere. So how is it that this stone get here? We did a minor surgical procedure to remove that small stone which was compressing the nerves, and the weakness immediately improved. Tingling numbness decreased. She was able to move the fingers once again. On careful examination of the stone, it was revealed that it is composed entirely of calcium hydroxyapatite, a mineral that is commonly found in your bones. Could this be a bone disorder, or could this be something called as dystrophic calcification, where calcium is deposited into different parts of your body without any cause? Dr. Raul was a genius, and he did not just stop there by removing the stone. He went one step further to ask the question, how did this stone get here? A job of a doctor is not just to treat the symptoms, but it is also at the same time to treat the disease which is causing the symptoms. And when he carefully looked at the history and the examination findings, it all seemed to connect. The natural history of the disease was right in front of him. All the complaints of heartburn since the 2-3 years, thickening of the skin of the hands, the calcific stone which formed out of nowhere, the small telangiectasias which are present on her back, the pain in her fingers on exposure to cold, and how they were all connected to her pregnancy. This is the exact moment when a neurological case turned to become a rheumatological one. And as Dr. Rahul whispered to himself, CREST. Could this be? Could this be CREST syndrome? CREST is an extremely rare case consisting of 5 things, as the acronym CREST tells us. Calcinosis, which is the deposition of calcium all over the different places of your body, which explains the stone which formed out of nowhere. Raynaud's phenomena, which is a peripheral vascular disease affecting the arteries which causes numbness and tingling in the fingers along with cyclical color changes. E for esophageal dysmotility, which she was experiencing in the form of heartburn, acidity and GERD for the last 2 and 3 years. Sclerodactyly, which means thickening of the skin, and T for telangiectasias, which are already present in her body. All of these symptoms pointed Dr. Rahul towards the rare diagnosis of CREST syndrome. But as it is a rule in medicine, the rarer your diagnosis is, rare is the chance that you will be correct. So he immediately ordered a lot of investigations. A specific one was something called as anti-nuclear antibodies. CREST syndrome is actually an autoimmune disorder in which your body makes antibodies which actually damage your own cells. Anti-nuclear meaning the antibodies which are directed towards the nucleus, the proteins and the DNA material which is present inside there. There are so many numbers of antibodies which can be present in a person, right from anti-dsDNA, anti-RNA, anti-centromere, anti-SCL, to just name a few. And what he found out during this investigation was that she was positive for a certain antibody called as anti-centromere. Your DNA is made up of a long string of nucleotides, and one single cell of the human body contains 2.2 meters of DNA. This DNA has to be packaged tightly and chromosome formation happens. And over the chromosomes are something called as centromeres. Centromeres are essential for packing of the DNA. The antibodies which we found were actually directed against these centromeres. Confirm the presence of the thickening skin to be actually sclerodactyly or scleroderma, a limited form of the disease. He ordered a skin biopsy, proved that he was actually correct. This was a limited scleroderma which was present. How does this disease actually occur? In most of the cases, it is due to an acquired genetic defect, a mutation in your gene, which makes your body go into a molecular war within itself. Related to a common rheumatological disease called as SLE or systematic lupus erythematosus. Here too, there are anti-nuclear antibodies which are present, which cause a variety of symptoms. What is very specific about this disease is that here, once the cells are destroyed by the antibodies, a lot of macrophages invade and they cause fibrosis. They deposit collagen fibers, and gradually over the course of the disease, this collagen fibers cross-link with each other. This cross-linking of collagen actually causes the stiffening of the skin. It causes the increase in the thickness of the skin and causes problems with joint movement. If the similar condition is happening inside your esophagus won't be able to contract properly because the muscles are actually replaced by fibers. And due to this, there will be some sort of esophageal dysmotility which will be present. This dysmotility will be presenting to you as acidity, as heartburn. And if it's happening to the arteries of your hand, it will present as Raynaud syndrome, narrowing of the blood vessels on exposure to cold, and it causes intense pain. So how is it all related to her pregnancy? You see, pregnancy is a state of change, a change in a female's body which is unprecedented. In pregnancy, the Th2 type of immune response is exaggerated, whereas Th1 type of immune response is decelerated. So all the diseases that are occurring due to Th2 will definitely flare up. Diseases like SLE, diseases like scleroderma, and diseases like CREST syndrome. So her pregnancy actually accelerated the disease which she was already suffering from since when she was a college student. As soon as this remarkable diagnosis was made, she was started on proper treatments. Treatment for this disease is not curative, you cannot cure it. But there is definitely some ways in which you can slow down or stop the progression of this disease. That is what Dr. Rahul did. He successfully identified, diagnosed and treated a disease which is extremely rare. If she had kept on ignoring the symptoms, she might have come to us with complications such as loss of digits, amputation of entire digits because of the artery being fibrosed, or something like cancer of the esophagus due to reflux of the acid through a metaplasia called as Barrett's. So the moral of the story is, it's okay to Google your symptoms. We are all human, we all do that. But these symptoms, when together clubbed, a doctor can make a diagnosis 10 times more better than Google can. This is my message to all the intelligent viewers who are watching this. Don't ignore the symptoms. एक दो बार ठीक है. But if they're consistently happening, go to a qualified medical professional and get it checked out, because most people will not be as lucky as Renuka to come at just the right spot where we could save her. If you like this video, please make sure to subscribe and also hit the thumbs up button, and let me know down below in the comments by saying episode 2 was awesome, waiting for more such episodes. Again, you can go buy Oswal using the first link in the description. Thank you so much everyone. Goodbye and take care.